Welcome everybody to the Global Autism Summit. Today we have a very special guest with us. It's our friend, Dr. Shapiro, and welcome, Doctor, to our event.
Thank you for having me.
Could you talk to us about yourself and what do you work on?
Sure. I'm a developmental behavioral pediatrician in Rockville, Maryland. I see patients, or I used to before the pandemic, in my home office. Now I'm a Zoom doctor for the most part. In addition to consulting with families, evaluating children, taking care of them very directly, I have developed a parent training and support program called Parent Child Journey. If you're interested, go to parentchildjourney.com. And this is a program that gives parents an individualized approach to helping children with special needs. And I'm pleased to be able to offer that on a pay-what-you-can basis. So the idea is to make developmental and behavioral pediatric care more affordable, more available. So that's a night job of mine.
Yes, that sounds so interesting and so specific. Like, I love when I find pediatricians who knows a lot about developmental processes. And, if you know about behavior, then there's a lot you can share with us for sure.
I hope so. Yeah, so I did practice primary care, general pediatrics for 13 years. And then I subspecialized in developmental and behavioral pediatrics. So my practice is about the whole range of developmental disabilities and developmental differences, ADHD, anxiety, learning disabilities, mood disorders, movement disorders, and autism.
Uh-huh. Wow. It's very interesting when you can have experience with different diagnoses or different patients with different situations. And I'm wondering, what do you realize through your experience with autism?
Well, I've learned more from people with autism than I can say. And autism has a way of highlighting normal developmental variation. And it sensitizes all of us, I think, to the wide range of humanity. So I have learned to give up my old views of success. Autism teaches me, and all of developmental difference teaches me, that there are many, many paths to a successful and good life. So for all you people with autism out there who have been my teachers on that, thank you.
Oh, this is so beautiful. And can you tell us what was your old pattern? What was your old belief system
Oh,
about
yeah.
it? Yes.
You know, white privileged guy in the United States, raised to think about being a doctor, lawyer, etc. You know, getting into that good college was the definition of a successful childhood, right? And
Uh-huh.
then I became a doctor and found that not everybody follows that straight and narrow path, and not everybody should.
Mhm.
So, not everybody should go to college. Some people should definitely not go to college and find a different path to a meaningful life. So some old views of success have fallen by the wayside. I don't have anything against college, and some of my best friends are doctors and lawyers, but I'm pleased to say that my view of what life can bring has broadened because of my experience with my patients.
Oh, yes, that's so special. And I love when you say a meaningful life, because that makes a huge difference. Like if you compare the word success to meaningful life, then everything change inside of yourself. Yes.
Yes, I agree. Well
Oh,
said.
that's so amazing. I love it. And what are you planning to share with us today?
Well, I guess we had talked, Anna, about a pediatrician's perspective
Mhm.
on developmental difference, and I will focus on autism. So if you like, I'll bring up a PowerPoint and share some thoughts
Wow.
about diagnosis
Uh-huh.
and then about case management, because kids with autism need to be identified early so that we can intervene and help them along their way. But they're often complicated, and we need to make some hard decisions sometimes about what is important and what's not, what should be on the front burner, what should be on the back burner. So a little discussion about case management too.
Yes, this
So
is very, very
I'll be
important.
happy to share some of those thoughts with you.
Yes, please.
So let's take a look here at some slides as we go, so we can stay organized with some ideas. And I've got my website up, parentchildjourney.com. Again, if anybody's interested in those training programs. And what I'm going to be talking about today in terms of diagnosis is largely taken from my second book, Parent-Child Excursions. There is a fourth chapter in there, or a fourth excursion as we call it, on autism specifically. But the book is largely about the interplay between ADHD, anxiety, and autism. So you'll hear some comments from that book. And then my discussion about case management, setting priorities, is taken from my first book, which is the foundation of the parent training program, Parent-Child Journey. So if anybody's interested, those are available on Amazon.com. The DSM-5 was rewritten, the Diagnostic and Statistical Manual that we go by, was rewritten in 2013. And at that time, we gave up some boxes where it used to be that autism was divided into classic autism, something called PDD, or pervasive developmental disorder not otherwise specified, and then Asperger's, the kids who had high verbal abilities, and then some other conditions that are more rare. Since then, we decided to think about a spectrum, that there are not nice, neat boxes within autism. As we say, that's like trying to cleave meatloaf at the joints. There are no joints in meatloaf. There are no discrete boxes within the autism spectrum. So it's all a range of human variation. And so I've put up the DSM criteria because it's helpful to a degree. So number one is you need to have significant persistent deficits in social communication and interaction. So it used to be when we were screening for autism, we'd ask, hey, is your child not speaking by 2 years of age? That would be a red flag for autism. Since then, we've learned that many people with autism actually have very, very good verbal abilities, can actually be advanced. And there are people who have language delays. So red flag for language, yes, but the more important piece with autism is the social reciprocity. So now, instead of just asking, hey, is your child talking by 2 years, we ask, hey, is your toddler sharing engagement? Is the child pointing to the airplane and wanting you to see the airplane with them, and creating a triangle between you, the object, and them? And it's a shared point of reference. People with autism early on show a lack of that kind of joint attention, that kind of back and forth, like a tennis match where you give a volley of language or of nonverbal communication of play, and you expect it to come back and back and forth the social interaction goes, even at a very young age. We want to see that kind of social connection early on. And the certainly screening for lack of social reciprocity, not just language delay, is a key to early diagnosis. As we go along, we see that individuals with autism have difficulty with peer interaction, but that'll be later. In the preschool years, early on, it's about that joint attention, that social reciprocity. We also have with autism, beyond the social disability, the restricted repetitive patterns. So these are kids who will do the same train motion over and over and over and over again, or have special interests where they're fascinated just by washing machines. And they have to have everything about washing machines. It's washing machines all day long. So this adherence to tight routines, the difficulty with flexible shifting off of a very special interest, an area of hyper focus onto something else. So this is the picture for autism, the combination of social disability and repetitive, ritualized, stuck kind of behavioral or cognitive patterns. And this has to be present in early childhood, but as life goes on, as expectations change, we see these differences more and more clearly. So this is how we diagnose autism, by looking at these things. At different ages, different symptoms come up, but that's the gist of it. Now, I want to make a point here that this kind of categorical diagnosis, is it autism or is it not autism, is only one type of assessment, one level of assessment. There's also so-called etiologic assessment, where we look for underlying causes of developmental variation, and functional assessment, where we look across domains of development. And I'd like to just explain a little bit more about the difference between categorical, etiologic, and functional assessment, because the general point here when you're talking about helping individuals with autism is the category and the cause don't matter as much as the day-to-day functional perspective. Let me explain what I mean by that. So categorical assessment is what we look at through the Diagnostic and Statistical Manual, the International Classification of Diseases that's used by insurance companies to reimburse for care, and the World Health Organization. And this is important to say whether a child has autism or not, or ADHD or not, or learning disability or not. These are categories of assessment, and they're important because they allow kids to get services through their public school system, through the government. It allows kids and families to get reimbursement through their health insurance companies. It helps doctors communicate with patients and families, and helps professionals communicate with each other about general issues facing certain people. And it can demystify developmental difference. When we say somebody has autism, we hopefully help them understand why there's a developmental difference, that it's a brain-based disorder that we know a lot about. And it can drive important research. It can bring people together. There is an autism pride movement that I think is absolutely wonderful, where birds of a feather flock together. People with autism can understand each other and support each other in ways that neurotypical people can't. So there's some very, very good things about categorical assessment. But the old saying is, if you've met one person with autism, you've met one person with autism. So people with autism are as different from one another as they are alike. So how to help them has to go beyond categorical assessment to something else. What about the cause? Is that something that can guide treatment for people with autism? No. So if we find a specific genetic marker, and more we are able to identify gene variations for people with autism, if we find a specific metabolic problem like phenylketonuria, if we find a toxicologic problem like fetal alcohol syndrome, well, there is not one size that fits all when we identify a cause. People like to think if we can just get down to the genetic or metabolic or toxicologic causes of autism, then we might have a magic wand that we can use that's just right for them. But even though finding a cause helps with research and may help parents understand better the brain basis for variation, it doesn't guide management. The one exception on the list here, phenylketonuria, there is a specific dietary intervention for these individuals, that's for sure. But beyond that, you still need to individualize your supportive services. So what do we really want to look at? Functional assessment. And this is what a good neuropsychologist does when they look across domains of development and asks, how is the child doing with expressive language, receptive language, fine motor, gross motor, social, executive function, attention, you name it. Every domain of development is assessed. You get a baseline, and you're looking here at splitting apart the child's functioning in all these different domains, not just lumping all people with autism together. And here we want to have a baseline that where in some areas we might be functioning at a higher level, in some areas at an age equivalent lower level. And kids have uneven profiles that come out only when we do this kind of functional assessment. It's about strengths and weaknesses. It might be also about inhibitory control, whether you're over-inhibited or under-inhibited in different situations. So it's a very, very rich portrait. The baseline tells us where we are, what the next level is, what we need to target, and this is what allows us to move forward with a truly individualized approach, functional assessment. So when I am doing case management, shifting to that discussion now for somebody with autism or any developmental difference, I ask parents, hey, if you only had one or two magic wands, how would you use them? And we have parents, and we help them with this, assess their children, do a functional assessment for motor activity level, impulsivity, attention span, other aspects of temperament like adaptability, initial reaction, intensity of reaction, mood, regularity. And we ask, hey, are those a big deal? Then look at sensory profile, whether you're hypersensitive or undersensitive to noise, speech, taste, smell, light touch, deep touch, movement, physical symptoms, etc. And we, whoops, slide went backwards. I want to go forward. And then we want to look at fine motor, gross motor, language, spatial relations, visual arts, music, math, executive function, social, environmental issues, physical issues, all of these different domains of development. And we ask, hey, which areas are the biggest deal? Which areas of concern are going to be the biggest hurdles in the road going forward? And we assign a score to each of these facets of development. 0, not that big a deal. 1 to 3, even still very minor. 4 to 6, moderate. 7 to 10, severe. So those facets of development that are going to be the sources of greatest compromise are the ones that we're going to intervene on. We can't do everything, and we shouldn't do everything. We should ask, where are the main issues? This should also reflect strengths. What areas of strength in the child's profile do we want to invest the most time, money, and energy nurturing and fostering? Because a child's future depends at least as much, I'd argue more, on their areas of talent and interest than on fixing the relative weaknesses. So magic wands can be used not just for weaknesses, but for strengths as well. And then what you do, once you decide which areas of development, which domains of development you need to invest the most in, then you ask, who you're going to call. So if you have attention, self-regulation issues, then you're going to talk to a medical doctor with a prescription pad and consider a treatment trial for ADHD symptoms, and you might supplement with some behavioral help. If you've got the primary issues have to do with mood regulation, that aspect of temperament, then we start usually with cognitive behavioral therapy and may or may not supplement with medication if anxiety, irritability, mood dysregulation are a significant source of impairment. If you've got sensory differences, Generally, it's the occupational therapist, but there's overlap with other professionals. If you need a magic wand for fine motor, again, the occupational therapist. If you need a magic wand for gross motor differences, physical therapists and other therapists, including sports therapists, occupational therapists. If you need a magic wand for language, your speech language folks and tutors. If you need a magic wand for visual spatial issues, art therapists and art teachers. For music, for math, for executive dysfunction, we have our specialists for each of these domains of development. For social skills, a primary area for people with autism, there's any number of professionals who can help either individually, in group therapy, or in parent-centered therapy. And you want to find people in your community with autism expertise. For physical health, environmental stresses, school placement, and for overall support for the family, we have our range of professionals that cover that wide range of issues. And last but not least, a care coordinator who helps a family do this kind of thinking. What about functional assessment? Which domains do we need to support the most? And a pediatrician, a developmental specialist, a special needs navigator can serve that very, very important and often overlooked role. So once you decide who is going to be helpful to you in each domain, then you want to make sure you use a science-based approach. In autism and developmental disabilities in general, there's a lot of non-science-based talk out there. You get on the internet and people are talking about camel milk and massage therapy as treatments for autism. There's no evidence to support many, many treatments out there. So you want to rely on good science that's founded in good research and go with those interventions that we know are not just going to be a waste of time, money, and energy. So this is usually a combination of supports, treatments, and you'll need a specialist to help you navigate that very, very complicated issue of what to do and who's to do it. And then you have baseline ratings, outcome measures, any intervention, you should be able to measure how well it's working, because even if there's an evidence base, you want to make sure it's working for your child. And you don't continue an intervention that isn't showing you the kind of results that you're hoping for. You change it or abandon it and go with something else, again, with an expert's help. So those are my quick thoughts buzzing through on diagnosis and case management. And I hope it's helpful.
It's very, very helpful, and it's very clear because now, like, everything have been changing, right? Like, we had a different type of diagnosis before. Now we're talking about a spectrum. So there's a difference in between one way of doing it and now how it's happening, because now kids who have like more level symptoms are diagnosed, and before they were not diagnosed with the right diagnosis. Do you have any specific recommendation for parents, for young parents, for example,
who are wondering whether their child might be on the autism spectrum?
Mm-hmm.
Yeah, go to an expert to really have a good assessment first. A lot of people jump to management when they haven't had a good assessment. So that's key. And there are folks who really have wonderful working knowledge of autism, and then there are other people who don't. And so these days, there's so much access to good care, and it can be had online these days. The days of having to have an expert in your community are gradually or quickly with the pandemic fading. So with telemedicine, we can review videos, we can do extensive interviews, and you should access the people who really are very, very familiar with the nuances, the subtleties of making diagnosis in young children. You can be very suspicious of autism during the first year and a half of life if there isn't that reciprocity, if there isn't that feeling of connection. The best experts in the world, though, cannot make a reliable, durable diagnosis of autism until 18 months of age. And even then, if it's a subtle case, if you're in a diagnostic gray zone, even then you can't always be certain, but at least you follow over time and you can start with intervention. So the earlier we intervene, the better, to help the kids along with their social connection, with their language, with other issues that may be associated. So early is good.
Yes, that's the like a key, right? Like if early interventions make a
Absolutely.
huge
Yep.
difference. Yes, thank you
Absolutely.
very much, Doctor. And we know we have a gift for you have a gift for the public.
I'm happy to offer a free subscription to my online learning program, the Parent-Child Journey. It's over 8 hours of video instruction, taking you systematically through behavior management. You can see what that's about on parentchildjourney.com, parentchildjourney.com. To learn about the program. And it's a self-paced program that you'll get for free. One of you will get for free. And if you want to, in parallel, there is a live discussion group that helps you with implementation of the strategies that are introduced in the online learning modules. So we're very excited about being able to offer this. And our results have been very, very gratifying. Other people who complete the program really do see positive changes in their children's behavior.
Oh, thank you very much. I know everybody's gonna enjoy it a lot. And thanks for sharing all your knowledge. Well, or part of your knowledge and your experience with us.
My
And
pleasure.
thank you, thank you. And thank you, everybody. We will see each other during the next chapter with our next interview. Bye.